Good morning, friends. I am Dr. Ashish Chaudhary, Head of the Department of Orthopedics at Akash Healthcare Super Speciality Hospital, Dwarka. From today, I am going to start a series of 1-minute videos on various advances which we have made in the knee replacement surgery. Specifically, a novel program which we have started by the name of Speed Knee Program. So what does this Speed Knee Program stand for? This SPEED actually is an acronym for 5 things which we have collected together to make a team program, which includes S means safety of the patient, P means painless procedure, first E means express rehabilitation, the second E means exact fit, and the last D in the Speed Knee program implies durability. So all these 5 elements, which are extremely important for the success of knee replacement surgery, have been included as a part of a team effort so as to give a great patient experience. So in today's video, I would like to dwell upon the first part, that is the S, that means the safety profile. So whenever any elderly patient comes to us for our knee replacement surgery, the most important thing is that we should not do any extra harm to the patient. Patient is here to get the best out of the knee replacement, and it should be functionally rehabilitated in a safe manner. So there has to be a dedicated pre-operative evaluation, including multiple referrals from various specialists, so that we are very sure that the patient profile has been checked adequately, the medical condition has been optimized, if at all there is some deficiency found on the investigations, and the patient is fully ready medically, anesthesia point of view, and also surgically to undergo a procedure as big as knee replacement surgery. So in the following videos, I will be talking about the other elements of this Speed Knee program. Thank you.